Hello, everyone. I'm James Milan. Welcome to this town hall update. I am speaking this week, as we occasionally get to do, to Christine Bongiorno, who is, of course, the director of the Board of Health, among other things, here in town. Christine, it has been a little bit since we saw you, so thanks for joining us.
Thank you for having me, James.
Lots to talk about, and people are definitely going to be interested, I know, so let's get right to it. I think the biggest news nationally and also locally lately has been the FDA's approval of the Pfizer, BioNTech COVID-19 vaccine for children ages 5 to 11. And I know you and your team got right on that and conducted a couple of vaccination clinics recently that were very well attended for that age group. So that's yet another milestone reached in this long battle with this COVID-19. And can you tell us a little bit, though, what this, about the clinic and just in general, what it means to get this age group vaccinated?
Sure. Thank you. So yes, we were very well aware of the process that was happening at the federal level. Our State Department of Public Health had really given us the heads up that they were going to pre-stage the vaccine and get us up and running as quickly as possible once the vaccine was approved. So what we did here locally was we established a number of clinic dates. We found locations and staff, volunteers, and we were ready to go. We pre-staged clinics in order to be ready to roll out the vaccine immediately once it was approved. We had a clinic, I think it was 3 or 4 days after the approval on a Saturday. I think it was approved on a Tuesday or Wednesday, and we had our clinic on that following Saturday. And we sent the link out the day before to have families register. And unfortunately, or fortunately, our clinic appointments, we had 1,200 appointments. They were gone within, a half an hour, which was great. And we were able to have that clinic. We vaccinated 1,170 children at that clinic. And then we had hoped to do two clinics the following week. Vaccine never arrived, so we ended up having the clinic the following week after that. So we just had a clinic this past Tuesday where we did an additional almost 600 kids. So we've done about 1,800 children that attend school or live here in Arlington, which I think, when we look at our data locally, we're seeing an increase in cases, which we're seeing across the country, but particularly we're seeing the cases in the youngest population, so the 0 to 19 age group. And so we're hopeful that by vaccinating this age group, we're able to sort of slow that spread down. And once they're fully vaccinated 2 weeks after the second dose, we're really hopeful that those numbers will start to come down a bit. And, it's really perfect timing with the holiday season, end of year celebrations, families gathering and traveling. We're just hopeful that by getting ahead of that with vaccinations for children, we're able to really help protect our community.
Yeah, so you were mentioning that it sounds like the numbers are around 1,800 or so children who have been vaccinated via these clinics. Obviously, the total population of 5 to 11-year-olds here in town is larger than that, and I think there's also pharmacies and doctors' offices and things like that where kids can get vaccinated. Is that right?
Correct. Yes. All of our pharmacies in town and surrounding Arlington are vaccinating children, Arlington children, as well as children all over the state. Doctors' offices, hospitals are doing small clinics. So yeah, I think our numbers will be pretty solid by tonight. We receive a weekly update from DPH, the Department of Public Health, on our vaccination rates. And so obviously we'll be eager to see that tonight to see how we're doing in that age group.
Yes, and now that a substantial number of Arlington's children in that age group have been vaccinated, how you mentioned a little earlier that rates are going up here in town as they are nationally, and certainly in the state. How does this new vaccinated population change Arlington's overall vaccination rate, and where are we now? Where should we be? How is our infection rate looking here in town?
Yeah, so we are doing really well here in Arlington as far as our vaccination rates. What we're seeing is there is unfortunately waning immunity with the vaccinations. So the governor actually just this morning announced that boosters would be available to any resident that has been 6 months since their last vaccination. So that is something that there were a few governors out in the western part of our country that were doing that, and Governor Baker came out this morning and moved that forward, which I think is a really good move, because I think when we look at our data and we do our interview with each case that comes into our system, we're seeing that a lot of our cases are previously vaccinated individuals, so that they're actually getting the virus from just very random spots out in the community, and we're seeing that some of these individuals are becoming extremely ill, and that's obviously of great concern. Vaccination is important to prevent death and hospitalization, which we're seeing our deaths and our hospitalizations are pretty low. They're not zero, unfortunately, but they are low. So we will continue to really urge unvaccinated individuals to get vaccinated. But we're also urging residents, our community, to get the booster if they have been vaccinated if their second dose was 6 months before, previously. So we are actually pivoting now here in our department to start offering booster clinics. We have found it extremely difficult to access booster appointments ourselves. So, our first responders, our team here in the department have been trying to find appointments, and it's a challenge. And so we identified that as an issue, and we have set up a number of clinics over the course of the next few weeks. We will hold booster clinics, until there is no longer a need here in town. We will be offering Moderna vaccine only at these booster clinics, and they are really only geared for those individuals that have been previously vaccinated 6 months out, and people that are 18 and over, because we're using Moderna. So, we're hoping that it alleviates the demand on the pharmacies and the physicians, and it really gives people an additional spot to obtain that booster.
Yeah, it sounds a little daunting that, this is big news. We're lucky to talk to you at this time on a Thursday and hear this for the first time, that the booster eligible population has been expanded in that way. But if you're already having trouble accessing those shots, and now there's a lot more of us, I fit into that category myself, who will now be eligible. How do you see that working out?
Yeah, I think that we're already seeing a shortage of open spots. And so, I think having this opportunity to vaccinate here locally on a larger scale as best we can do in a small space. We're going to be using town hall. So we're pretty limited in our space there. But, I think any little bit we can do here in the health department to really help alleviate that demand and to get people protected, particularly, as I said before, prior to people traveling for the holiday season, the end of year celebrations. I think what we see and what we saw last year is that the gatherings really will, unfortunately, potentially cause additional cases, and we want to prevent that as much as we can, and to protect people. Obviously, if people are previously vaccinated, their risk of severe illness is pretty low, but we also just want to make sure that they're not able to then spread it to others that are unvaccinated or at extremely high risk of complications from COVID, people that have underlying chronic health conditions.
Right. Another piece of news that I think people have been anxiously awaiting, if you are able to share it with us, is the fact that the Board of Health met last night to review the mask mandate that has been in play, the indoor mask mandate, I should say, that's been in place here in town for quite a while now. So what is the result of those discussions?
Yes, so the Board of Health, they did meet and reviewed our local data. And so in our mask mandate that was established in the beginning of August, the board decided that they would really base their offering. So basically, rolling off the mask mandate based on the county data that the CDC puts out. The CDC transmission map, county transmission map, really says, if you're in a county that has high transmission or substantial transmission, they urge individuals to wear a mask. when indoors and in indoor public spaces. And so the board really felt that that was important to make sure we have that in place here in Arlington. And, personally, I feel as if that should be in place across our county, but unfortunately, there is no county form of government. We're really relying on local cities and towns or the state. And so Arlington has a mask mandate. The board met last night to say, that we would look more at local data, that the board would look more at local data as opposed to the county data. Because I think that, we in Arlington acknowledge that our county is extremely different across, the various communities. It's a very, very diverse set of communities. So the board decided that they would look at local data. Now, when they looked at the local data, they look at our current case data. They look at trends. They look at the sewage data, the MWRA sewage data, and they also, they're looking at our positivity rate. They're looking at the school data. They're looking at our vaccination rate. And what they saw was that the trend is that we're trending up. We're going up in cases. We're going up in positivity rate. And so the board felt that, last night was not the time to roll back the mask mandate, that it would give our community a false sense of security. It would potentially cause an increase in cases. And it really is important that, particularly through the next few weeks, we continue to require masks indoors and also just continue to evaluate the data. I do think, again, as I mentioned previously, we are coming into a very busy season where we expect people to be gathering unmasked in private settings. And so our fear is that we will see an explosion in cases. By vaccinating the children, by providing boosters, we're really hopeful that those strategies will help us get to a point where we can roll off the, come away from that mask mandate. But as it stands, as of yesterday, the board decided that they would keep the mask mandate, but each meeting will evaluate the data to make a determination.
All right. Well, thanks for that explanation. Obviously, the news itself will be, not welcome for most of us, but also with an explanation like that, I think it's perfectly understandable how the board deliberated and why the decision was made. So we'll move forward and hang in there. Last thing is, you've already referenced several times the fact that we are coming up to the holiday season, but I wonder, obviously you are aware and have acknowledged people are going to gather as they do on holidays, indoor, unmasked, et cetera. What recommendations do you want to share, though, with people for, navigating this upcoming season as safely as possible?
I think particularly in families that have family members that are they're unvaccinated, so the youngest children or those that are really at risk for severe complications, really trying to be aware of that and making sure that people are maybe limiting the size of the gathering, or maybe having every individual participating in that gathering get tested. We have home tests people can access quite easily. I think that would be my recommendation. It's something that my family and I are considering. By Thanksgiving, my children will not be fully vaccinated, so it's something that we have discussed in my own family. But I think it's important for people to be aware that COVID is not, unfortunately, it's not over, and I think we all want it to be, but it is still impacting families, across our country, around the world as well.
All right. Well, thank you very much. There's never any fluff in these town hall updates, whether we're speaking to you or to Adam or anybody. But really, this one particularly content rich, again, around stuff that people are desperately wanting to, have the latest information about. So thanks for providing that for us. We really appreciate it.
Thank you.
And we'll let you get back to work. We know there's a lot of it. I have, of course, been speaking with Christine Bongiorno, who is the director of our Department of Health and Human Services here in town. We really appreciate Christine's time. Thanks so much. And we also appreciate your time. Thanks for tuning in. I'm James Milan. We'll see you next time.